Firstly, remove all caries and permanent restoration. Using a round burr or tapered fissure burr, penetrate through enamel and approximately 1 mm into dentin. Aim for the largest canal. The angle of penetration should match palatal tail of clinical crown. Penetrate the tooth until pulp chamber using the same burr. Remove the roof of pulp chamber completely using a round burr or tapered fissure burr. Identify all canals using endodontic explorer, followed by small size K file. Remove cervical bulges or dentin shelves using carbide burrs or Gates-Glidden burr. Then use endo-Z burr. Determine straight line access by inserting largest file into the canal. Visually inspect and evaluate the access cavity. For maxillary molar, firstly, remove all caries and permanent restoration. Then, by using round burr or tapered fissure burr, penetrate through enamel and approximately 1 mm into dentin. Aim for the largest canal. The angle of penetration for posterior tooth should match for palatal tail of clinical crown. By using same burr, penetrate the tooth until pulp chamber. Penetration angle should be toward the largest canal. Remove the roof of pulp chamber completely, including pulp horn using a round burr or a tapered fissure burr. Identify all canals using an endodontic explorer, followed by small size K file. Remove cervical bulges or dentin shelves using carbide burr or Gates-Glidden burr. By using endo-Z burr, instrument should be placed at orifice level and lean toward dentin bulge. Determine straight line access by inserting into canal the largest file. Visually inspect and evaluate the access cavity.
Hi guys, this is mandibular premolar tooth. Remove all caries and permanent restoration. Using a round burr or a tapered fissure burr, penetrate through the enamel and approximately 1 mm into the dentin. This is the cross-section of the tooth. Aim for the largest canal and the angle of the penetration should match the palatal tilt of the clinical crown. By using the same burr, penetrate the tooth until the pulp chamber. The angle is parallel to the long axis of the roots, both in the mesodistal and the buccolingual directions. Use a round burr, a tapered fissure burr, or safety tip diamond or carbide burr to remove the roof of the pulp chamber completely, including all the pulp horns. Limit the penetration of the burr to the distance measured. Re-evaluate the situation to prevent gouging of the wall or perforation. Identify all the canals using an endodontic explorer to locate the canal orifices, followed by a small size K file. Remove cervical bulges or dentin shelves that frequently overhang orifices in posterior teeth with safety tip diamond or carbide burrs or Gates-Glidden burrs. Instruments should be placed at orifice level and lean towards the dentin bulge to remove overhanging shelf. Determine the straight line access by inserting the largest file into the canal. Visually inspect and evaluate the access cavity. Check the axial walls at the junction for presence of an orifice that might indicate an additional canal. The orifice and coronal canal must be evaluated for any bifurcation. This is the mandibular molar tooth. Remove all caries and permanent restoration. This is the cross-section of the tooth. Using a round burr or tapered fissure burr, penetrate through the enamel to approximately 1 mm into the dentin. Aim for the largest canal and the angle of the penetration is the lingual tilt of the clinical crown. By using the same burr, penetrate the tooth until the pulp chamber. The penetration angle should be towards the distal orifice because the pulp chamber space is usually the largest just occlusal to the orifice of this canal. Using a round or a tapered fissure or a safety tip diamond or a carbide burr to remove the roof of the pulp chamber completely, including all the pulp horns. Limit the penetration of the burr to the distance measured. Identify all canals using an endodontic explorer to locate the canal orifices, followed by a small-sized K-file. Remove the cervical bulges or the dentin shelves that frequently overhang orifices in the posterior teeth with a safety tip, diamond, or carbide burrs or gates, Glidden burrs. Instruments should be placed at orifice level and lean towards the dentin bulge to remove the overhanging shelf. Determine the straight line access by inserting the largest file into the canal. Visually inspect and evaluate the access cavity. Check the axial walls at the junction for presence of an orifice that might indicate an additional canal. The orifice and the coronal canal must be evaluated for any bifurcation.